Call the member for Noosa.
Thank you, Speaker. Our frontliners, whether public sector staff, not-for-profit, support organisations or volunteers, continue to be overwhelmed in their daily roles. There is a recurring theme. In Noosa, violent incidents this year, one resulting in a fatality, involved individuals experiencing mental health issues who have been within the system. We have residents who portray themselves as being homeless, who have social housing units nearby, one with an NDIS carer, yet without follow-through after hospitalisations nor avenues to assist, are creating ongoing angst in communities. Our weekends are being spent responding to Facebook tags and messages without breaking confidentiality, making calls to services who have no answers. Then those sleeping rough who have been offered help yet refuse as they battle with their mental health challenges, creating greater workloads for all as residents continue to report to numbers provided over and over. We have non-verbal residents who live with carers becoming homeless due to complaints from neighbours about uncontrollable noise impacts. Being continually moved on, they do not have the stable home they need and deserve. Planning laws do not keep up with these needs, which include group housing on acreage. Speaker, Department of Housing units in complexes have at times at least one tenant with a mental health condition that impacts severely on other tenants, creating further trauma, increased workloads from complaints, with little in the way of solutions to offer. Statistics that are not public domain and should be would clearly indicate the increase in time spent by our police in this space. They already have an overload with the increases in domestic and family violence, with data again not being made publicly available. Attending to incidents relating to mental health, escorting patients or ensuring paramedics and mental health co-responders are kept safe in their call-outs are contributing to the lack of visibility of policing, and that is adding to the concern of communities. This is in effect a hidden demand, even though it's not classified as, and resourcing allocations must accommodate this. As our hospital mental health wards battle with increased numbers of Queenslanders being admitted involuntarily or seeking assistance for themselves that cannot be provided, our emergency departments are the next stop, with those not meeting criteria for admission released, causing further impacts to themselves, their families and communities. Parents trying to access mental support for their teenagers is one of the most heartbreaking, as unless their teens want help, no avenues appear available to assist until a major escalation with impacts that are devastating, including suicide. That parents cannot access information about the status of their children who are admitted once they hit 16 years old is furthering the heartbreak, impacting the mental health of these parents. Just last week, the Courier Mail reported the increase in abuse directed to Queensland MPs. However, unacknowledged is that our electorate staff are experiencing residents fixated on them, something once reserved for those of us elected, impacting their own mental health. The Queensland Fixated Threat Assessment Centre is an incredible resource, often able to arrange mental health assistance when all other avenues have failed. However, it is sad that these cases have had to escalate to this level before receiving help. Previous inquiries into youth crime have shown that many perpetrators are impacted by mental health issues, including fetal alcohol syndrome, unresolved childhood traumas and multiple comorbidities, leading to diminished capacity for their actions. As I have written to the Minister, much more needs to be done, including ensuring more support and services are available after 4 p.m. on Fridays. Mental health does not operate to business hours, and we urgently need in our communities localised co-responders with funding streams that can be accessed by volunteer organisations so they can provide in-person assistance at night and on weekends. We have come a long way in removing the stigma surrounding our mental health and fitness. However, we need to address the reality being experienced. With outreach services not coping, support not easily accessible, particularly over weekends, and our frontliners overloaded, there are important conversations to be had. We replaced many decades ago institutional care for those who cannot care for themselves with outreach support and independent living, which is failing for many. We need to look at what options can be developed to keep communities and those with mental health challenges safe. A conversation that needs to be had, as we are increasing the trauma through a domino effect instead of diminishing.